against your public transit funds to make the outside match without drawing other outside dollars. So there's a lot of different ways. It's a complex process.
Follow up.
Go ahead.
I just wanted to know, do you have any specific names? Like, are there any non-government organizations or any kind of non-profits that you can tell me now that are helping match the funds?
Well, yeah, over the last 10 years, the Endowment for Health has put over, well over $1 million into matching grants for transit entities around the state.
The Endowment of Health?
The Endowment for Health.
For Health.
Yeah, located in Concord, and certainly Tri-County CAP has been a recipient of some of those. Concord Area Transit, when I was there, was a recipient of some of those. The Charitable Foundation has also provided matching grants for transit in various pockets around the state. So, and there are other, grant opportunities. Sometimes you need to go and seek them out, but those are two in this state that have been used heavily.
If I email you, can you give me a list of all those nonprofits that are helping match the funds?
I'd have to do some research, but I could come up with a few more probably.
Well, it says at the top of your presentation paper, funding. It shows all this words of funding. I just wanted to know what was all that funding, so we should know that specifically.
I can try to get that for you.
Okay, thank you.
Okay, last chance. Anybody from the public? Any further comments or questions regarding the RCC? If not, I want to thank you very much for sharing information with us. And good luck with your organization.
Thank you for having me.
Forward.
Appreciate it. Thank you.
Do we have some minutes that we can approve?
We're talking about public. I have two sets of non-public.
Go ahead.
The public minutes of the 31st of August, I want to table those till next week because I get the minutes. I got a set of minutes where I had questions and I say a couple things, and later I get another set of minutes and it's been taken almost all out, and then it said referring to GovernmentOversite.com. So I don't know why from my is taken out. I have non-public minutes.
Okay.
I think I gave it to you this morning. Is it the 31st?
Yeah. 30.
Yeah, I make a motion to approve the non-public minutes of August 30, 2011 and keep it sealed.
Can I make an amendment to that?
You second the motion? I'll second the motion for discussion. Go ahead.
I just want to say that I just did some minor corrections in
Oh,
wording.
is it, you did grammar?
Yeah. Spelling and grammar.
Otherwise, you're all right.
Yeah.
Okay.
Okay,
We're talking about none.
we'll add the amendment to the motion, if that's all right. That we
Yep.
approve the minutes as amended.
From August 3rd, 2011
You
and keep it
accept that?
sealed. Yeah.
I will also second it. All those in support of the motion say aye.
Aye.
Aye. All those opposed? Unanimous? So voted? No other minutes?
I have the 27 here, it's ready, but I didn't see Robin. I have just a couple of little grammar correction and two things or three things what I put in because it was on the tape. But it's not really changed. So I think she already sent it to you. I think you have those minutes.
Okay. Do you want a chance to read those?
Can you sign this one? And I make a motion to approve the minutes of August 17, 2011.
What was the date on that one? August what?
17.
17. Have you seen that one? August 17th?
I don't know what he's doing.
She makes some grammar correction, so I approve it with amendment with the grammar corrections.
I can't read this, so I can't approve anything. I can't read what she's added, so I don't know.
I'm going to run a Dr. Robert, maybe she can. Put it in.
And those are closed minutes.
You want time to read them?
Yeah.
Okay.
I'm trying to figure out
We'll
what it
hold
says.
them.
And what was the date on those, please?
These are Wednesday, the 27th, these are closed minutes.
Those are non-public.
And it's July 27th.
I'm sorry, I should have said that.
It's all right.
All right, we'll hold those. Maybe we can get to them by the end of the meeting.
And I make the motion for that, for the August 17 one, 2011.
Yeah, but she hasn't. Have you had a chance to read these?
August 30th, this one?
No.
August 17th. Regular meeting.
Oh, yes, I did read these. Yeah, I put in the correction.
Okay. I'll second the motion. All those, any further discussion on the minutes for August 17th? Hearing none, all those in support of the motion to approve the minutes for August 17th, say aye.
Aye.
Aye, and so voted. Anything else?
No, because she's going to read the non-public of the 27th.
Right, we'll hold that one. Okay, Jason, please, where did he go?
Excuse me, on the
Do we have-
17th pass with corrections. I'm sorry.
Yeah,
Yes.
it's here. Do you want to
Yeah, 'cause
see that?
I don't have one, it's just, okay, thank you.
Morning, Commissioners.
Good morning. For those in the audience that are new, Jason is superintendent of the jail. How's the correction?
Okay, the current population this morning, we got 53 in-house, 1 weekender, 7 transfers, 3 out on electronic monitoring, 22 on pretrial release for a total population of 86. Took in 19 inmates last week, 5 were repeaters and released 15 of them. Repeater charges, 1 came in for violation of probation, booked 2 times in 3 years. 1 for criminal mischief, booked 11 times in 13 years. 1 for protective custody, booked 6 times in 6 years. 1 for felon in possession of a weapon, breach of bail, criminal trespass, and theft, booked 2 times this year. And 1 for violation. 2 times this year. And then 1 for violation of probation, booked 3 times in 4 years. I have a meeting in about an hour and a half in Concord to discuss the preliminary report from Attorney Lee's office. I put a report, her initial report, on your desk downstairs, so if you can refer to that when you conclude the meeting today.
Okay.
The 2 new hires we have, they already started. 1 was a certified officer out of the state of Maine. So I'll be able to get him certified through our state this year. And the other one has corrections experience as well, so I hope to have him certified by the end of this year as
They
well.
all can pass the physical?
Mm-hmm. Yep. With respect to the subcommittee meeting last week, I think we reviewed the budget. Everything looked good. There's some questions. I believe I answered the questions through the chair. I also wanted to get some information and feedback from their commissioner's perspective on the presentation made, as well as the chairman of the subcommittee, so I can get a just a flavor of what
Regarding presentation
the presentation of the
Prime care?
Nope, the 2 doctors that we have.
Ralph and Schweiger, the guys who used to work for Prime Care.
Wait a minute, what are we talking about here? Say that again.
The presentation from Dr. Brager,
Oh,
Dr.
okay.
Schwager, they did a presentation for the subcommittee as well.
You think they can come also and do a presentation just for the public, so we have the
They were
camera?
here.
Yeah?
We already
What
did
year?
that.
Yeah, they were
Yeah, they
here.
already?
Mhm.
Your comment, Mr. Babson, being
I
chairman of
thought
that
it was
subcommittee?
Primex that came in.
They too came in.
When did
What
they
would you
come in?
like me to talk about? The budget seems to be in line,
3
with the
weeks ago.
exception of a
3-4
couple
weeks
of
ago.
items that Jason
Check it,
explained
was I
away
here?
very
Was
clearly.
it August 3rd?
Why don't I wait till the other meeting?
Yeah, I think so.
Okay, go ahead.
The two doctors, I think, answered all our questions. I'm not sure how the rest of the subcommittee felt about it, but I think we're prepared to go before the delegation and explain to them what these gentlemen want to do and have done. There's some question about coverage, I think, that the committee felt. They claim to be within a phone call away, but there's only 2 of them, and it's 24/7, so I think we have to discuss that. But I thought they did a good job.
Have you put together analysis as to what our present funding or cost is versus what they are planning on charging for their services?
Yes.
Is there a
To answer the
savings?
question, well, the savings that is kind of, it's up in the air. I would hope that they would be able to bring the costs down. They talk about being able to negotiate prices with the pharmacy company to drive those costs down. That's yet to be determined. They talk about bringing more coverage to the facility and not having to send inmates out to have certain services done. So without them being able to be in a position to do that, I really can't answer the question. With respect to, do I have it in my budget to bring them in now? I do. So I could bring them in with their cost that they'd like to contract for, and have that covered in the budget.
I'd like to say that, I'm going to say it besides that, I'd like to say, that both Prime Care and these 2 gentlemen who came in, they, just like a laser beam, concentrate on the savings on the pharmaceutical aspect. That seems to be unanimous for both of them, that they can bring down the cost to the county by half in terms of the pharmaceutical costs. And that's if both of them are saying the same thing, I have to think that somehow they're going to be able to do that.
I want to say by, and I'm not sure, Representative, if you have the remember the numbers or not, but I think we had spent year-to-date somewhere around 48% of our medical line, and out of that 48%, over or near half of it was dedicated just to pharmacy costs. So,
Okay.
Is there no nurse that knows the formula that can write those prescription?
no, they're
You need a
nurses.
physician assistant?
The
or doctor?
doctors have to be the ones that prescribe it, and I don't know as if the nurses know the cost of each medication that's out there.
But we cannot use the doctor from the nursing home.
He's not practicing at the facility.
So you need someone who practices at a facility and who write those prescriptions.
Yes.
And because we just need a generic, that is what we need, that is cheaper.
You need
Not
some
many cases.
you need somebody to oversee the formula, set the formula up. I don't have that experience
Can we
to.
not just have a nurse, a person is just doing that, because that is what we need to save money there?
Nurses can't prescribe medication though.
So the only one is, we need a physician assistant.
You need somebody that has the ability to write prescriptions. Yes,
So
ma'am.
RN cannot do that.
No.
But
Is
a
there-
nurse practitioner, he can do that.
A nurse practitioner, yes, can.
So we cannot have a nurse practitioner?
The one that I
We
have.
need the formula and.
The one
so
that
we
I
can
have
save.
is going to be leaving the facility, so